can I just ask, for people that are watching or listening to this and they want to do some at-home screening of their breathing, what are some of the things they could do without having to go to a clinic or see you in Australia? Let's say there's somebody in England here, and then we'll go, okay, what could be some screening tests we could do? Maybe not necessarily the control pause, maybe there's some things I haven't even heard of. So I'd love to just get your thoughts on what we can do at home.
Look, I think breath holding time is a good screen. It's a good screen, and I think that it's easy. It's just that don't assume that if it's short that you're hyperventilating. But if it's short, just know that there's tension in your breathing system. There's something's making you want to, your system's revved up, and your breathing will be revved up with that. It may or may not relate to low CO2. But I think breath holding time's a great test. And I love that potato style of doing it, where you're holding the breath at functional residual capacity, which is that point at the end of a natural exhale, which is the natural resting point of the breath. Great thing to do. And then people say, well, how long should it be? And really, when I measured my, 85 people and I looked at the averages, I was finding that, it seems like around, between 25 and 30 seconds is sort of what healthy people with reasonably good breathing were doing. That's until the first urge to breathe. Then if you keep holding until the first involuntary movements coming from the muscle of breathing, that when you were doing your free diving training, you get the jerks or what they call the struggle phase of breath holding, that the body's sort of doing this by itself. It starts to want to breathe by itself. So the very beginnings of that struggle phase of breathing, or the involuntary, I call it, BHT or breath holding time, IRM, involuntary respiratory movement. And that usually comes 10 seconds after the first urge to breathe, actually. Okay. So then you can see how accurate your first urge to breathe actually was, because first urge to breathe is a little bit of a vague measure because people are different in their interoceptive kind of sensitivity, And that's got, you've got people with really dysfunctional breathing who just are very disconnected from their body. And they don't feel anything. They don't feel first urge to breathe, but then they wouldn't feel somebody hitting them, on their foot with a hammer sort of thing. Not exactly, but you know what I mean? It's like they just don't have that great interoception. And then you can keep holding as long as you can, the maximal breath holding time, and that generally will be around double what the short breath hold was. So you would like to see someone having a short breath hold of about 30 seconds, around 40 seconds for the point where they get their first involuntary motion of the respiratory muscles, and about 60 seconds for their maximal breath hold. That would be a nice kind of benchmark to go for. I know a lot of people out there in the breathing world sort of go, oh, no, you should have, a control pause of 60 seconds. First urge to breathe should come at 60 seconds. You'll never find that in an untrained person. I've been working with breathing as the main part of my work now for, since I was 40, I'm 70. So how many years is that? 30 years. And in those 30 years, I never found a single person with a breath holding time of 60 seconds unless they were an elite athlete who's really trained their breath holding time. Sometimes when people have gone off on a meditation retreat for 10 days and they're super relaxed and chilled out, they come back and they will have a short breath hold of 60 seconds. But in the walking wounded, the rest of us wandering around, you just don't see that,
Yeah. So I've seen some people that do a lot of slow breathing and they have a really good control pause.
Yeah.
And then I've seen other people and all they do is they hyperventilate. They do the conscious connected breath. They do the Wim Hof breathing and they've got a really good control pause and they're not doing any slow breathing and the other ones aren't doing any hyperventilation work. Could you just maybe help me demystify this a bit? Because it seems like both of them are influencing their breath holds.
Yeah, well, when have you measured these breath holds? After the breathing practice?
So this would be, I mean, we would use something that is from the Oxygen Advantage called maximum breathlessness test, which is essentially same as the control pause, but just walking on the spot. And how many steps can you do before you can't do any more steps? And
Yeah,
that would be a
yeah,
measure. And so
yeah,
with that measure, I've seen all sorts of things happen. Like I say, I've got people that are not very fit, but they're really chilled out because they're just doing the conscious connected breath all the time, and then the great space, and got really great maximum breathlessness tests. And then I've got other people that started off quite low. Maybe they're doing 30 steps. And then I've worked with them for 6 weeks, and we've done coherence breathing and slow breathing, biomechanical stretching, and we've worked on their sleep. And then they've got
yeah,
up to sort of 70 or 80 steps.
yeah,
But it's just interesting that there's almost two opposite things going on here. There's a hyperventilation, and there's also a slow breathing client. And this measure of how long can I hold my breath, they've
yeah,
both got really good measures, even though they're doing completely different things.
yeah, exactly. So yeah, because it's not a direct measure of CO2, right? So that would partly explain it, but it's a measure. Breath holding time is a measure of the biomechanics of breathing and the person's general level of physiological arousal. The efficiency of ventilation, perfusion, and so on. Like it's a measure of general breathing fitness, but also of just state of being, really, how relaxed you are. And you mentioned that you've got them doing other things. So you've got them working with sleep, you've got them working with, self-regulation strategies throughout the day, da-da-da-da-da-da. They're using the breath. Honestly, if you're focusing on the breath and not just pinging around in your own head, doing usual rumination, and you're actually spending portions of the day, connected to the body and connected to the breath and doing a lot of that, that's just going to make your breath holding time better, because breath holding time is strongly influenced by a person's level of tension, the tension in their body and the tension in their breathing muscles.
I was just going to ask, what's a good at-home screening for mechanics? Because I know there's Dr. Belissa Vranch's Breath IQ, which is where we look high-low, and then we get a tape measure around the lower ribs. Do you have any other versions of a way people could screen their mechanics at home?
Yeah, I think high-low is a good one. I think that, one hand on the chest, one hand. I use the high-low as well, especially if I'm evaluating people online. And it'll be like, connect with the body, connect with the hands and the breath. And notice during the inhalation which hand moves first and which hand moves more. And ideally, you'd be wanting to feel a balanced breath. And then, the next thing you might do is ask a person to take a deeper, stronger breath and observe what happens. And you know what? You might see the top hand moves first. But that doesn't mean their breathing is dysfunctional, because the chest will always move more on a bigger, stronger breath. So I don't immediately go, oh, your breath is dysfunctional. But then the real test comes when I say, okay, one hand on the chest, one hand on the belly. So you did that when I said take a deep, strong breath. That's all right. Most people will. It's actually quite a normal response in an untrained person. But then I will say, okay, can you take a bigger, stronger, deeper breath and have your hands move evenly? And if they can do that, generally their breath is functional, because they can do it on instruction. But the person with dysfunctional breathing, they can't. They will never be able to get the breath balanced or into the belly. So they've lost that flexibility and the ability to do that.